Malaria is a life-threatening disease transmitted through the bite of female Anopheles mosquitoes. It remains one of the world's most serious public health challenges and has taken millions and millions of lives every year. It is most common in tropical regions, especially in sub-Saharan Africa, and of course Nigeria is one of the countries that has felt most of its negative impact of malaria on the continent. Whilst children age 5 and pregnant women are most vulnerable to this disease, that has ensured that it has taken more lives if we've not taken certain actions to prevent them from happening. And of course, symptoms of malaria also includes fever, fatigue, headaches, and of course running temperature. And for prevention, insecticide treated nets are of course prescribed for families so they can help prevent the impact of malaria on them. And of course, spraying your rooms with insecticide of course is one of the ways you can also tackle malaria by ensuring that it doesn't spread and affect families. For early diagnosis and prompt treatment, it is key for you to ensure that your families and you of course as an individual is well in good health condition, and make sure you do your routine checks to ensure that you are not affected by malaria. You're welcome to Health is Wealth on ITV. My name is Mustafa Usman. I'm joining me live on the studio today is Chuks Alu, our guest today. He is the Monitoring and Evaluation Officer for FCT Malaria Elimination Program. Chuks, good afternoon and welcome.
Good afternoon, Mustafa. Thank you for having me, and good afternoon, viewers.
And of course, Nigerians and a lot of Africans know what malaria is, and it is an epidemic that needs to be tackled. Before we go deep into details, tell us about malaria.
Yes, malaria is a febrile disease which is transmitted by a bite from a female Anopheles mosquito. By this it means that the Plasmodium parasite is being transmitted from one infected person through the bite from a female Anopheles mosquito. And some of the symptoms we just want to measure on is that it's usually associated with fever or onset of fever for the past 24 hours. Why am I saying this? This is because some people might want to present at the healthcare facility and they may have taken some form of analgesic, and so when you ask if they have fever, they'll tell you no, they don't. But usually for one to have malaria, there must have been fever. Either the person is currently having fever or has had it in the past 24 hours. And so when this happens, it is also important that you get tested using either the rapid diagnostic test kit or microscopy to ascertain if it is actually fever due to malaria. This is because some other diseases may also present with fever. And so when it is positive, then it is advisable that the person take the right artemisinin combination therapy, that's ACT. And the most vulnerable people are children and pregnant women. And so in the fight against malaria, they are being prioritized. It is not like every other person is not being cared for, but in terms of the most vulnerable persons,
most impacted.
Yeah, it's the children less than 5 years and pregnant women.
How badly, does malaria really affect the most vulnerable? I mean, in details, if you can tell us.
Yes, malaria can kill if not being properly attended to. It kills within minutes. Yeah, that is the moment it goes from the uncomplicated malaria to severe malaria. It becomes a battle, so that at the time it takes for me to pronounce malaria, over 100 children are already battling with their life somewhere. And because these are children their immunity has not really built as strong as those of adults. And then pregnant women, because they are pregnant and carrying a fetus inside of them, it is very easy for the Plasmodium parasites to hide in their placenta without them knowing it. And that could cause several negative effects on the mother or the child, as the case may be. It can even lead to abortion of that child or low birth weight if that child is eventually delivered.
Tell us about seasonal malaria chemoprevention. We know it is an anti-malaria. It is the administration of it makes it very effective for anti-malaria drugs during the peak transmission season. Do you mind enlightening us about the SMC, as it's been fondly called?
Okay, yeah. Seasonal malaria chemoprevention (SMC) is an intervention that targets one of the most vulnerable population, that's children under 5 years of age, and it is the use of a specific anti-malaria medicine for prevention in this age group. So, and this is usually done during the peak malaria transmission era, which is the rainy season. Yeah. The seasonal malaria chemoprevention is implemented in regions where about 60% or more of the annual rainfall occurs between 4 and 5 months. And so FCT falls within this area. And so in FCT we implement seasonal malaria chemoprevention from the months of June up to October, since inception from the year 2022.
So, talking about the SMCs, how has the implementation strategy been? How much of an impact has the people in the FCT felt it so far?
Okay, so the strategy for implementation is door to door.
Okay.
It is a house-to-house intervention where trained community drug distributors move from house to house, administering this seasonal malaria chemoprevention medicine to eligible children. And usually, for one to be eligible, that person has to fall between the age of 3 months to 59 months. And then such person must not be sick, because we say it is for prevention. And so since it is not for treatment, it is not given to somebody who is already sick.
Well, so SMCs are only for the vulnerable, and which covers children aged 5 and below and pregnant women. Any other person are exempted for SMC? Is that how it's been done?
Okay, yeah. For SMC, it is only for children.
Only for children?
Yes.
Not even pregnant women?
Not for pregnant women. There's another intervention for pregnant women. But for this vulnerable group, these children less than 5 years of age, they are the ones that are eligible for SMC. And like I said earlier, that child must not be sick and must not have taken any sulfur-related drug within the last 28 days. Why am I saying this? This is because the anti-malaria medicine in use here is sulfadiazine pyrimethamine and amodiaquine, termed SPAQ, SPAQ. And so for any child who has taken any sulfur-related drug like Bactrim, cutriomazole, and maybe any anti-malaria medicine, including amodiaquine, is exempted from taking until the next cycle, which is usually after 28 days interval from the initial dose. And so when these trained community drug distributors get to this household, they ask questions. Is your child sick? If the answer is yes, of course that child is already disqualified, as in is not eligible. Let's use that language. The child is not eligible to take in that cycle, because we implement 5 cycles from the month of June to October. So it means that if that child is not sick in the next cycle, he or she is eligible to take in that one. And then for the age, it must be children who are 3 months to 59 months. For those who are not up to 3 months, they are not eligible.
So how do we recognize the agency that's in charge of administering these drugs? Because I think some people who, of course, frown upon this type of door-to-door intervention programs for certain reasons, by the way. How are we supposed to recognize them, and what agencies actually behind this, so it can be easy for people to actually know what is happening?
Okay, seasonal malaria chemoprevention is being implemented in FCT by the FCT Malaria Elimination Program, that's in Public Health Department, with support from Malaria Consortium. And so the trained community drug distributors, that's the CDDs, usually wear SMC
vests,
clothing.
Okay.
Yes, it is usually written on their clothes, SMC. And then they also have caps. Yes, something to identify them that will make you know that these are actually the community drug distributors. And they are also selected from within the community, so they are known within their environs.
Oh, that's very good.
Yes, so the selection was based on closest to your community. And then it's being implemented from about 274 healthcare facilities, that's public healthcare facilities
in the FCT
within these communities. So it is still community facilities that those around the settlements are used to.
Oh, that's amazing then. And what are the importance and the benefits of the SMC so far?
Yes, SMC, like we've said, prevents malaria. And if it is being taken to complete the 5 cycles, it builds a very good therapeutic immunity within the system of that child, such that it does not come down easily with malaria. Yes, studies have shown that SMC prevents about 75% episodes of malaria cases. And of course, you know that it is uncomplicated malaria that gives a yield to severe malaria. And so it also means that it has also prevented about 75% severe malaria cases. Yeah, and as it is now, the FCT populace are already beginning to testify to the results that are being gotten from this seasonal malaria chemoprevention, because caregivers will tell you that since inception, their children no longer come down easily with malaria. And so it has also reduced the number of hospital attendees due to malaria.
Due to its, despite its widespread acceptance, I think there's been a lot of myths and misconceptions concerning the SMCs. And some parents go as far as saying that if a child is not sick, why administer a drug on them? Well, others come out to say that the drugs might be a bit too heavy for the kids to actually carry. But then again, how has this sort of narratives being helped in administering these drugs against malaria? Because I know some of these things can be felt negatively. Sometimes some parents actually carry out this and ensure that some of their kids do not receive these drugs due to some of these myths flying around. How has the agency so far been able to maneuver these questions and these myths and ensure that they carry out their jobs in ease and reorient these parents?
Yes, so this is where community sensitization and giving out the right information comes in, and that is why ITV is also playing a role, just like it is doing now. Because when you have the right information, you'll be able to know when an information is not right. This is because the drug of choice here, sulfadiazine, pyrimethamine and amodiaquine, are drugs that are readily available in our pharmacies. It's just that this particular one has been packaged by some philanthropic funders who want to contribute their own quota to prevention of malaria and also cases that might be leading to death. So by that, it is free, but it does not mean that somebody has not paid for it.
Okay.
Because of course it's being procured by Malaria Consortium, which means somehow it's been paid for. But it is free, and this is because the organization and the funders want to prevent possible deaths from this vulnerable group.
Are there side effects for the abuse of these drugs? Because I know some certain persons, due to greed, may want to get their kids administered more than once within a period of time. Are there side effects to this?
Of course, certainly there will be side effects if it is abused. But then it is also being, care is being taken to ensure that it is only given out when it is supposed to be. That is once in a month within the period of the 5 months that it is being implemented. And so for those who are not eligible, who might also want to benefit from this intervention, usually the community drug distributors tell them the age range such that for those who are already above 5, they don't need these drugs, because the drugs have been packaged in doses that are only sufficient for that age group. Somebody who is above 5 may not be getting the required effect from it, and so there's no point taking it when there are options. There are options, like in FCT under the leadership of Dr. Dolapo Fashawe. There is this intervention that is being implemented in all public health facilities where testing and treatment of malaria is free. Yeah, so you can walk into any public health facility in FCT and get tested and treated for malaria.
Oh, that's amazing.
Yeah, that intervention is being supported by the Life and Livelihood Fund under the Islamic Development Bank. And so it's been on for a while. It's just that it has not gained the
traction,
popularity that it's supposed to gain.
Okay. Before we go, I would like to talk about community leaders in these communities you go to administer these drugs. How has their support been so far in ensuring that these SMCs get to the right channels?
Yes, their role has been very enormous You know, you cannot enter into any community without informing the owners of that community. And so the community leaders are also being carried along. They are trained. They were also trained alongside community drug distributors, town announcers, and even the OICs of the facilities, including some area council team. So the sensitization is such that the community leaders are already aware of the benefits of these drugs, and so it is easier for them to pass it on to the people around their settlements.
All right, thank you so much, Mr. Chuks Alu, for coming as a guest today to answer these really important questions on SMCs. And for the parents out there who are watching this program right now, SMCs are very important. SMCs are life-saving. So if you see these providers who come to try to administer these drugs, rather than repel them, I think you should welcome them to your homes and ensure that children aged 5 and below are administered these drugs, because it helps prevention of malaria. And this is a call to action to ensure that children who, of course, are the leaders of tomorrow are well taken care of, and they are the most vulnerable to this malaria, and SMCs can only prevent them from getting sick. This is Health is Wealth on ITV. My name is Mustafa Usman. Thank you for being a part of the program. Have a wonderful day.
Okay, so